In this video, I'm going to discuss cervical cancer modalities available. So who needs a screening? The woman aged 21 to 65, and age and risk determine test choice. High risk women, HIV, immunocompromised, DS exposure, strong family history, may need earlier or more frequent screening. So what are the modalities available? Pap smear, cytology, examines cervical cells for precancerous or cancerous changes. Frequency 21 to 29 years, every 3 years, Pap alone. 30 to 65 years, every 3 years, if not combined with HPV. Widely available, inexpensive, good evidence, insurance covers it. It does miss some precancers, so lower sensitivity versus HPV. Verdict, long time, long-standing, reliable test. HPV DNA test detects high-risk HPV strains, especially HPV 16, 18. Frequency, age 30 to 65, every 5 years. HPV alone or with Pap. Pros, higher sensitivity than Pap smear, predicts long-term risk. Lower specificity, many transient infection clear spontaneously. Verdict, best for primary screening in women more than 30 years of age. Co-testing, Pap smear, HPV DNA. Both Pap and HPV done together. Frequency every 5 years. It's preferred in many guidelines. Pros, highest sensitivity, catches both cytology abnormalities and HPV infection. Cons is it's more costly than simple Pap smear. Slightly higher false positive. Verdict, most comprehensive approach for women aged 30 to 65. Other test, visual inspection with acetic acid, VIA. Is vinegar applied to cervix, precancerous area turns white. Simple, low cost test, no lab needed. In a small villages or remote area, there's something, or some other countries where these things are not available, it can be utilized and useful in low resource settings. Operator dependent, usually done by doctor and nurse practitioner, or some places even midwives or assistant. But it's lower specificity than HPV and Pap. Good for developing countries where Pap and HPV tests are not available. Colposcopy, magnified exam of cervix with biopsy if abnormal. That's colposcopy. Diagnostic is used as a diagnostic follow-up for abnormal Pap or HPV. It's not a screening test, not a routine screening test. So best towards Pap smear, reliable baseline test. HPV DNA, higher sensitivity, especially for women age more than 30. Co-testing Pap and HPV, best balance every 5 years. VIA, which I said that visual inspection with acetic acid, leave that for developing countries where the Pap and HPV is not available. So useful there. Colposcopy is diagnostic, it's not for screening. And blood and tumor marker tests, they're not useful. So thank you for watching Dr. PK Live channel on YouTube and TikTok.